Hello and welcome to our webinar tonight. Thank you so much for joining our continuing series of social emotional learning webinars hosted by Cloud9 World and Nasco Education. We're really excited and honored to bring you tonight this what will be a really powerful webinar on social emotional learning and specifically trauma-informed practice. Just a few logistics before we really get into the heart of our webinar tonight. Just to let you all know, there are some handouts with a little more information on Cloud9 World, who is sponsoring our talk tonight. And that is in the handout button within this webinar platform. There's also a question box. Please do type in any questions you might have throughout the webinar into that question box. At the very end of the webinar, we'll be doing some Q&A to have a little bit more of a conversation about the content of our webinar tonight. We also will be sending an email. In that email will be a recording of this webinar, as well as a survey and a certificate of completion for attending tonight's webinar. That email will send about 1 hour after our webinar ends tonight, so you can expect that pretty promptly. But again, if you have any questions, pop them right in the chat box. We'll reply to that email when it ends up in your inbox, and we'd be happy to answer them for you. So without any further ado, I'm going to get to introducing Melvin Hayden, who is joining us here tonight. Melvin Hayden is a motivational speaker, consultant, and certified cognitive behavioral life coach who values dedication, service, and excellence. As a decorated combat veteran, Melvin also brings a unique perspective gained from his battlefield experience to our webinar tonight, really hoping to empower us to unleash anything related to trauma. And using real-world examples, Melvin then sheds light on how untapped talent can be proved invaluable when trauma-related experiences are released. Along his path to success, he's accumulated a diploma in biblical studies, a diploma in modern applied psychology, a BA in human and social service administration, a master's in teaching and learning with technology, a master's in educational leadership, and a Psych D in clinical psychology. He also is certified clinical trauma specialist, a certified family trauma professional, a certified trauma support specialist, a certified cognitive behavior therapy life coach, and a certified neuro-linguistic programming person. So huge, welcome to Melvin, who brings these amazing credentials to share with us this really powerful webinar. So without any further ado, I want to hand it over to Melvin.
Thank you, Jenny. Thank you. And I appreciate everyone who's online tonight. Thank you for joining us. I'm going to get right into it because I love talking about trauma. I love talking about resilience. And I love the fact that all of you that are on here tonight have joined us tonight to receive something from this, to take back to your prospective organizations, schools, implement those things in your day-to-day, whether it be the classroom or your administrative duties. Whatever job or career that you find yourself in right now. So moving forward, I want to talk about trauma being defined. The National Child Trauma Stress Network says that trauma is an event or series of events that involve fear or threat. And that's pretty much all you get. And that's a very broad view of what trauma actually is. Because right now we are in a world where trauma-informed, trauma-sensitive, trauma education, and trauma consideration are all things that we're kind of like buzzwords, where everybody right now is talking about it. Everybody wants to know, how do I get more trauma informed, or how do I get more trauma sensitive? And how does that operate in what I do from day to day? And how do I either teach it or am sensitive to it to know when it's happening, or to see something that maybe someone else doesn't see? And the bottom line is, trauma is simply a reality that we all face. And it doesn't really matter how small or how big it shines itself in your particular situation. The fact of the matter, it's a reality. And anything beyond our ability to cope is trauma. Okay, so if you're able to write something down, if you're able to grab a pen, grab a notebook or a piece of paper, there's some things that I'm going to say that you might want to remember, and it'll also help you ask questions toward the end when Jenny fields those from the chat box. So trauma, again, is reality. because we all have experienced some form of it, whether it was extreme or minor. And in that moment, it was our inability to cope with what just happened that made it trauma. And that's the definition that I like to use. That's the definition I'll speak to, the platform of the definition that I'll speak to you guys tonight on. And I want you to really understand that when I say ability to cope, there are a lot of us that don't understand what coping is, or how, how it is done effectively. So when you're coping with something, or you've been told to cope with it, that means you're being asked to be effective. And when I'm coping with something, or there's something in front of me that I have to deal with, I'll say something as minute, that was not minute, but it's a pretty serious thing. But an athlete who sprains his knee, or a couple who just had a newborn baby, or an administrator who is on his very first AP or principal assignment. People ask you to cope with those things because they have very definitive ways in dealing with it. And when you're effective, then they assume that you're doing a good job. But being effective means production. It actually means that you're producing something positive, or you're producing something that works. And so when you're asked to cope, you're asked to be effective. And even when you're asked to be effective, you're asked to produce. But when you're going through trauma, you can't be effective or produce anything, because it's stunned. Trauma will stunt whatever you're moving forward to, or whatever you're trying to obtain. It won't allow you to move forward. So as a teacher or a student or an administrator, when you cannot effectively produce, there may be a reason for you to take notice at what it is, or what has happened, or what it looks like from the point you could no longer produce your product, or whatever it is you were working on, and how that has affected you overall. That's how you actually start defining trauma personally. And so so a lot of us look at trauma and we pass it off as just stress. Oh, I can't wait till the weekend, or we're going out on the boat, or we're going out on the lake, or we're going to the beach, or we're going to find some way to take our mind off of whatever it is that's going on with me, so I can have a little peace in my life. But that's exactly that's all you're doing. You're just taking your mind off it for a little while so that you could think about something else. But what happens when it comes? It's right there waiting on you. Trauma doesn't go anywhere. It's right there waiting on you when you get back from wherever you go. And so we package stress, which we package stress as life. It comes and goes, but the stress can lead to PTSD. Okay, extreme levels of PTSD leads to extreme amounts of stress. But we package stress and PTSD as normal life, and then we package that to be something that can be effectively looked at as mindfulness. We look at mindfulness as a way to deal with stress. And mindfulness are techniques and strategies that are geared toward decreasing your amounts of stress. But trauma can't be packaged. But it's the root of the other two. So where trauma presents itself, we may pass it off as stress. And when we pass it off as stress and allow it to go on unchecked, it becomes PTSD. And then after PTSD, it becomes extreme levels of stress. And then we start to use techniques that take our mind off things. But when you take your mind off something, all you're doing is allowing it to fester. Because when you don't deal with what's in front of you, it never goes away, and then it rears its head in another situation, and it starts to take over another situation of life. And then when you don't deal with it that way, it takes over another situation of life, because you continue to keep pushing it back and pushing it back. And so that's where we find ourselves when we're trying to define trauma. We actually have to look at where I stopped and how it affects me, because the moment I can pinpoint where this happened and how this happened, then I can define it for myself, and then I can talk to the particular situation that I'm in and move forward with that, whether it's a classroom or home or anywhere you are. And so when we talk about the three types of trauma, I want everyone to understand that there are three, actually four, but the three main types of trauma are acute, chronic, and complex trauma. Those don't mean anything. They're only words to give definition to what I'm about to say, because on the slide it says a single event, reoccurring, and complex. Definitively, acute trauma is just a single event. It happened once and that's it. Chronic trauma is what they say is reoccurring. It continues to happen. Complex trauma is what they say when it's a long-term effects or you continue to be exposed to something. The reason why I keep saying what they say is because I want everybody to understand that when you're into a trauma situation, and because of its event, there is no such thing as a one-time single event. A hurricane comes one time for that year, but the trauma behind that hurricane can be acute and it can be complex. The trauma behind a child in the classroom that goes home, and I'll just use the most extreme situation, doesn't have anything to eat or maybe homeless in the situation. That single event in their mind happens every day. And so when we say it's reoccurring, making it chronic, it can be complex as well because it's a prolonged situation. Anytime someone is going through a traumatic experience, okay, don't lighten the load by trying to put that experience of that child in a box, because it can't be. And when it happens, I don't want, myself as an example, or anyone else to get caught up in using definitions to define what it may look like for someone else when we're not the ones living through that situation. So to me, trauma is always complex. Trauma is always complex. Trauma is always complex. We do not go home with our students, and we don't know. A lot of times we don't know the background story. So when I attack it as a complex situation, I want to make sure that I'm covering all my bases. I want to make sure that I am the most helpful, most energetic, most empathetic person that I can be, so that I want this kid to know, as I'm trying to build this relationship with him or her, or am I trying to build a relationship with the family to help them through a traumatic situation. The last one is something that we tend to talk about but don't dig into a lot, and that's the historical and the intergenerational trauma. The multi-generational trauma, the things that continue to keep going on and on and on. When I have a kid in my classroom who is currently a designated felon who's been incarcerated for a number of times, and then I find out the older brother has been incarcerated. Then I find out that the father, then I find out that the auntie or the grandfather or the grandmother, and it just continues to go back generationally. And this is where it affects the economics of the family, the social stability of the family, the violence within the family. Historical and intergenerational trauma starts to affect race of all ethnic backgrounds, the oppression from different particular groups. We do not discredit any social group or organization based on what you believe, because trauma will do that. There's an oppressive feeling right now throughout the school system, throughout all school systems, throughout districts nationwide. We're dealing with laws that the federal government is trying to pass. We're dealing with people that have very strong views about all different types of things. And the reason why this creates a traumatic environment or a traumatic culture in what we do is because when our kids come to school, and even as adults, when we come to school, everything we hear, everything we see, and everything we learn comes exactly to that classroom. It comes to our building. And so now when we're looking at our classes and we're looking at our school and we're trying to define a particular culture of our school, we're trying to define a particular environment in our school, the way we want it to see, the way we want it to look like, the way we would like it to see it operating, sometimes we can't see that, because when the world walks into the door, it gives us a multitude of things to look at. It gives us a multitude of issues to start trying to correct, in the sense we want to address it and we don't want it to prolong itself. We want to make sure that we understand that when something happens to anybody in our school, it really does affect all of us. When a child may lose a parent because of COVID-19, or a teacher loses a sibling or a parent or a loved one because of COVID-19, that is traumatic for everybody in the building. And the reason why I say that is because it not only affects that student or that teacher directly, it does affect everybody indirectly. It actually does. And whether I know that teacher or not, or whether I know that student or not, I do feel some kind of way about it because everybody's going through it, and it's polarized in everything we do, in everything we say, and in every way, shape, form, or fashion that we operate on a daily basis. We're seeing this all the time. And so trauma happens in a developmental content. And when I say developmental content, there are three things that happen in this particular in the development of trauma. Now, the first development, we're talking about a disruptive attachment. That's a loss, like I just explained, a sudden loss, a separation. Um, I'll also speak in terms of not just talking to kids, but I'm talking to the adults as well. I'm talking to myself as well. Because we, as adults, we have abrupt losses. We have separations. The secure base that a child needs is the same secure base that we need. It's the same secure we need to be supported, and we need to have forms of support throughout life. We need to have those things for us as well. And so, because we are adults and we tend to make provisions for that, when our kids can't do that, when you're looking at disruptive attachment, you will see that kids can't give you eye contact. They do have not just a fear of strangers, but a fear of people. Um, and they need to feel the four things that will allow them to know that the relationship that they're building helps them let go and release those attachment issues that they may have. Number one, a kid has to feel secure. In a development context, when you're trying to disrupt their attachment phase, that you see a kid has a clinginess to you, and they'll start using words like auntie or cousin, or they'll start using terms of endearment to you, that they're trying to create some type of clinginess. Lack of eye contact, they don't want to look at you, or they can't see you, and it's not because they're being disrespectful, just for the simple fact that eye contact is hard for them. Fear of strangers, once they get to know you and get to understand who you are in your classroom, or get to understand the administrators that they deal with every day, anybody that comes in from outside of that box they've already created, that's a fear. And so kids have to feel secure, just like we have to feel secure. When they're being avoidant, not so into social interactions, don't hang around a lot of kids. You might see them alone all the time. But guess what? The truth of the matter is teachers do that as well. They're not always fun loving and walking around the building or the hallway. They have their own way of being social interactive with not just kids, but with other adults. And so when we're talking about kids being ambivalent, uncertain, or unsure, disorganized, undisciplined. And the last one, the disorganized, when kids are undisciplined, we're not just looking at behavior. Behavior is not a big thing or a small thing, but it does hold its own weight in the whole process of development. And so we want to make sure that when a kid is undisciplined, and we use the term behavior problem, let's look at the organization of that kid as a whole. Everything that goes into organizing, everything that's a part of organization, period. Look at that kid as a whole before we turn to just behavior and then forget about it. The cognitive delays in a development context. We all know about ADHD and oppositional defiant and all those things, intellectual disabilities, the autism spectrum, and different things like that. But the important part of the development context is to make sure that we're taking notice to it. that we're a part of the development, that we're not just a part of it in the sense of talking about it or being aware because they may have an IEP or a 504, or they may, there have been special accommodations, but we're not only aware of it, but we're addressing it in a positive way. We're giving those positive affirmations on a constant basis for those that we know need it. Limitations in mental functioning and in skill communication, taking care of oneself and social skills are all a part of the development context. The last and not least, but the impaired emotional regulation, how we deal with big feelings like anger and excitement, frustration, anxiety, or low mood. Those types of things have everything to do with the development of a student that you may have, or even a coworker that you may talk to, or a colleague that you're involved with on a day-to-day basis. What I do know is that there are two types of impaired emotional regulation. One is antecedent focus. The second is response focus. The antecedent focus are those that want to know why it happened. And the response focus are those that want to know what you're doing while it's happening. Both focus are very important, because we do have those that are more focused on the antecedent. We do have those that are more focused on the response, and we need that, because as a collective group, as a team, we need, everybody's not going to think and respond and act the same way that we would all like to. So in other words, you do have the people that need to know why it happened, and the people that need to know what were you doing when it happened. Why? Because we're not the ones, we're not the kids. We're not holding our phones, videotaping the situation, hoping to put it on TikTok. I said TikTok or Instagram later on, so we can get likes. We're actually trying to really knock a dent in trauma and how it affects our kids, so that they can start to live a little bit of what a healthy life will look like, or at least give them a view of what a healthy life looks like. And so here we come to the part where this is the common reactions to trauma. If you look at that list and the things that I put in green, are some of the things that we deal with on a day-to-day basis when it comes to trauma: anger, confusion. You can read them for yourself. But there are 5 trauma reactions that happen all the time. Direct, when you have a direct reaction, it's really 2 or more things that are happening at the same time. They're combined. We really do want to analyze the reaction. We want to debrief the situation when it comes up. And debriefing, oh my goodness, is not only one of the most important things. I always say that, I'm a dean of students at my school. I work with middle and high school students in an alternative setting. Sometimes I have to debrief with myself to understand where I was in the whole situation when it happened. And there's absolutely nothing wrong with debriefing with yourself. There's absolutely nothing wrong with you doing the analysis, before you get in a group, before you talk about it, to know where you were, where you stood in it all, and how you processed it before you talk. You have the displacement, you have the double displacement. And these are the feelings that the students have, that I put in green, and then I have some other things over there on the side, not to be ignored. They are very important, but I felt that the 10 things that I had, 9 to 11 things that I have here, were some of the things that I saw more in students than I did, in some of the other things. And so we always want to make sure that we are able to describe what we saw in feeling for ourselves, and then allow the kid to describe what they were feeling for themselves when we're talking about reactions. And so, I think I skipped one. Oh, no, I didn't. And so the responses. How are the responses? Well, you have 3 responses. And whenever you respond to something, you're doing it 2 ways. You're either responding to it in writing, or you responded to it verbal. And the question is always the reaction, which we talked about before, the resistance, because a reaction is nothing but resistance to a force, influence, or movement. So the last slide showed the reaction. That's the question that is being asked. What was forceful, what was influenced, and what was the movement? And so the answer is the response, because I'm only going to respond in 3 ways: behavioral, emotional, or psychological. Those are the 3 ways that I'm going to respond to the reaction, because a reaction is a force, influence, or movement. Any traumatic response that you're going to any traumatic response you're going to get is going to be because the trauma of the event was by force, by influence, or by some type of movement. And this is where we come to when we start talking about behavior and emotional and psychological, okay? Because I don't, the one thing that you don't want to do is get caught up in trying to diagnose every situation and every kid that comes through, trying to diagnose every small detail about his life or his family's life or his siblings' life if we know him. We just really want to look at the situation for what it is. There was a reaction, and this is what the response. And this is what I saw when I saw the response. And even if we have a chance to talk to the child or talk to the parent, we're talking to the child or the parent in those same terms. This is what I saw. After the fight, I saw that your son or daughter was crying. That's an emotional response. After the fight, I saw your son or daughter walk off, yelling, cursing. After the fight, I saw your son or daughter having a hard time processing what just happened. And because we're trying to get to the heart of the situation, not the situation itself. When you're dealing with a trauma response, and I see all of them as trauma responses, I'm trying to get to the heart of the situation. Not so much as, he hit me or she stole this or whatever the case may be. I'm trying to get to the heart of the situation. Why was your response so violent? Why was your response so emotional? Why was your response so behavioral? That's what I want to know, because I know the signs, and so when I see it, that's what I want to know, because what I'm trying to do and what I'm going to do is build a rapport. I'm going to build connection. I'm going to build a connection, which leads me to my next slide: building connections. That red piece in the middle of that puzzle, the reason why it's red, because it's a very important part of the program and what we're doing. And so when you are building connections, what is the first one? Says to realize. Well, when I realize something, that lets me know I'm my priority is relationships. I'm building connections so that when I'm in a situation where the impact of the trauma and understands potential path, that first part says for recovery. In order for recovery, I have to prioritize my relationship with who I'm trying to build with. So whatever connection I'm trying to build, I have to think about it as recovery for the individual. And in recovery, the only way that I can successfully do this is by prioritizing the relationship that I'm having or creating with this individual. Now, the second one is recognizing the signs and symptoms. Well, if I'm going to recognize something, then I want to know that at that point, I'm going to have to foster some type of wellness. I'm going to have to avoid negative outlets. The moment I recognize, okay, in this particular student or maybe in a colleague, the moment that I recognize what's going on, I have to form some type of wellness, create some type of help system so that I make it a point to avoid negativity. I realize and I start building connections by prioritizing my relationships. I recognize, and then I start building foster strategies of wellness and avoid the negative things that can come to it. So now I'm going to respond. When I respond, now I have to find purpose. Because if I'm going to respond and fully integrate knowledge about trauma, not only in the policies and procedures and practice of the school, but within myself, what am I going to do? 2 things. I have to be proactive about my approach, and make sure I have to move forward with my goals once I respond to what I recognize and what I've realized. So I realize connections. I recognize, going with wellness. I respond with purpose. And the very last one, it says resist re-traumatization. How do I resist re-traumatization? By embracing, it's going to sound a little fluffy, but I'm going to embrace healthy thoughts. Okay, bear with me 1 second. When I say healthy thoughts, there are two things, well, actually three things, but two things that are the most important when you're resisting traumatization is number one, accept the change. Accept the change, not just in that kid, but in you also. When you do these things in your program, or you're looking at trauma, or you've incorporated some part of what I'm talking about right now, accept that there will be not only a change in you, but a change in them. The second thing that we always have to do is learn. When I say learn from the past, I don't mean learn from the past 20 years ago. I mean learn from the past 30 days ago. All right, learn from what we just did. Learn from what we just implemented. Learn from what just did not work. Okay, and keep things in perspective. When you learn from the past, and when I say past, remember I said the past 30 days, keep those types of things in perspective for what you're trying to do. You're working with someone who has been severely traumatized over a long period of time. One incident turned into a reoccurring incident that turned into a long-term incident. I am a hurricane survivor of multiple hurricanes, being from the Gulf Coast and from the state of Louisiana. And one hurricane changed me forever. So you didn't have to have a hurricane. I didn't have to go through a Hurricane Katrina every year to be reoccurring. All I had to do was hear about a hurricane coming, and all of a sudden that was reoccurring. And every year we got hurricane season. So guess what? That's my long-term effect. So when you talk about complex trauma, has it changed me? Of course it has. Even though I don't live in the great state of Louisiana anymore or in the bayou, I still live in a place where hurricanes happen. And when they say there's a hurricane coming, you best believe I already have my hurricane getaway kit. It actually sits in a suitcase in the closet. So when I don't wait for the state to call a national emergency, I don't wait for the governor or the mayor to say we're evacuating. I'm usually gone a day before all that happens. Why? Because what I went through the first time, and by waiting and not leaving when I should, or not leaving when I thought I should have left, or any of those situations, doesn't even matter. Any of those situations caused me to change how I operate, hence now and forevermore. And that's the truth about it. So even though the trauma's past, in the sense of there's no, I'm not going through it at all, it did leave remnants for me in how I operate to keep myself safe. When we're talking about our students operate in a way to keep themselves safe. They operate in a way to keep themselves secure. They operate in the best way they know how to make sure that they're okay no matter what happens, because they really do have to fend for themselves. And we're actually talking about survival at this point. So 6 key principles of a trauma-informed approach, there they are right there. Safety, trustworthiness, and transparency. And if I heard Jenny right, I think this PowerPoint is going to be available to you for those of you that are on here now. I think tomorrow at a later date, so you may not have to worry about trying to write everything down. I just wanted to make sure that you understood some of the key principles in a trauma-informed approach for any school. And when I say trauma-informed approach, yes, I know we've heard it before, it's for the school. However, trauma-informed approach is for me. I want to be safe, and I want to make sure my kids are safe. I want to be trustworthy and transparent. I want to be a peer support. I want to collaborate. Sometimes I'm collaborating with the families of the kids that I work for. If I have to be the empowerment or the voice, then yes, I can be that too. And if I don't necessarily culturally or historically identify with the families I'm working with, you just best believe that I'm finding someone that can, because I want all my parents, I want all my students to know that we are a team. I'm a team with the rest of the people that I work with in my building, and we're all a team, and you're going to get the best out of us, no matter what that is, no matter what that looks like, every day of the week. And it's not hard when you have a heart for kids, and you have a heart for not just people's stories. I don't have a heart for people's stories. I have a heart for people being successful in the realm that they see themselves successful. I don't have outlandish expectations for anyone. I want the same expectations that I have for my students and parents are the expectations that they have for themselves, and that's to be safe. Okay. And so, organizational practices, simple things, you can read over it as I talk. I'm not going to spend a whole lot of time on this because reorientation, lead and communicate, engage. I'm sorry, patients, I meant students in organizational planning, parents in organizational planning, train both clinical and non-clinical staff, create a safe physical environment, emotional environment, prevent secondary trauma, stress, and staff, and build a trauma-informed workforce. Hey, look, prevent secondary traumatic stress in staff is extremely important. You guys, I said earlier, you don't always have to take a trip to go somewhere to be stress-free. You want to nail down and dig out the root of whatever traumatic situation that you've gone through so that it does not continue to hinder or harm or hamper your ability to be as successful as you possibly can. You do want to create an emotional environment where you are safe, both physically and emotionally. And to do that, to do some of those things, sometimes we do have to self-check ourselves in regards to where we are in a traumatic state. What happened to me when I was a kid? What did I push back in my mind that I've never dealt with? And how can I get rid of that? And how can I alleviate that from my mind and my body and my stress cycle so that I can push forward and continue to be not just successful, but be motivated, be happy, be healthy, those types of things. The 10 domains of implementation. If you are an administrator online or a supervisor or a teacher, when I say implementation, when I say implementation, I literally mean implementing these types of things in your space. So there are 10 domains. How would I put that? How would I put all that into work? Well, I actually have these 10 domains in my office. And even as the disciplinarian, the dean of students, the administrator in my school, I put these things into action as best I can. Some of these things, well, most of all of them do apply to me in some shape, form, or fashion. But if they didn't, I would still have them up there because I want to be aware of what I'm doing and how I'm doing it. Most of this are conversation pieces with the kids. They always want to know what's on my wall and what does that mean and what are you doing now and how does that affect me? And I tell them without full transparency, this is what the domains mean and this is what I like to implement in my life. I always reflect it to my life. I never talk about a universal implementation within the classroom or within the school. I always reflect it because that's actually how I build a lot of the relationships, because they want to know, Mr. Hayden, how are you going to encourage, what's physical environment? How are you going to do that in your own life? Engagement and involvement. What are you going to engagement? What is that? They have all these things they ask me, and that's how I create the dialogue between them and I, to get them to talking about things that maybe they have never talked about. To get them to talk about things that gets me in a little bit, where I get to know them a little bit better than I did before either that day or that conversation. And so this is the part that why social emotional learning. Now, we're talking about trauma. And you say, well, how does social emotional learning fit into trauma? Well, being social is a part, and being social is how we support ourselves as well as our students. It's how we actually help people feel comfortable or uncomfortable around us. And being social sets the table for conversation or confrontation. Now, and this is the SEL. So when you take the E out of SEL, you're left with social learning. Man, how do we socially learn? By three things: observation, experience, and assessment. We look, see, and hear in observation. Our experiences are connected to our beliefs, our culture, our environment, and our relationships. And guess what? We assess our experiences on a constant basis. And that is really what social learning is. The emotional learning, how has what I've experienced affect my efforts to be positive, encouraging, inspiring, and motivated? Our emotional learning is tied to my experiences and how those experiences have affected my efforts to be positive, encouraging, inspiring, and motivated. When we're doing SEL in regards to trauma, we're here to teach you how to socially interact by simulating an emotional response through teaching, counseling, or mentoring to really create a heartfelt interaction so that the other person can believe in what resembles a relationship. That's what we're doing. And that's how trauma and social emotional learning work hand in hand. We're constantly building up, how do we building a foundation of success, staying positive, being prepared, creating a list of things. We're focusing on efficiency. And one of the last things I want to say about when we're building a foundation, over communicate, be involved in your other colleagues and what they're doing. And if you know, honestly, you should really say, did I tell you that already? You should so over communicate with each other that you should have to wonder if you already told them what you're telling them again, just to make sure you're telling them over and over and over again. That's how you build a foundation of success. Prioritize the tasks that you do. When you create a list, only create a list of things that you know you can 110% complete today. Really, I have 10 things on my list. I cross out about 4 because I know I'm not going to get to it. It looks good, right? And it definitely, if someone is coming to check on what I'm doing, especially in this climate, we have supervisors and super supervisors checking on everything we do to justify our jobs and why we're in the building. You know, I can put 15 things on the list, but I know that I'm only going to be able to effectively execute 4 and be good at it. Be prepared in everything you do. Let me tell you something. When you are preparing, make sure you read, research, interview, rehearse, study, whatever it is that you have. Make sure that you're adequate at what you're saying. And I don't mean that you're not. I'm saying that when the kid, you know, as we're dealing with our students, it is impressive to know what you know. You know, our kids don't necessarily tell you, wow, Dr. Hayden, you're really smart. They assume I'm smart because of the education that they see, you know. But I really want them to know that I know things. I really want them to know that it's not because of what people call me or what you think I have. I really want you to know that I know some stuff, like I know a little bit. And I want to give that to you, intertwined into the lesson that I may or may not be teaching you at the time. And one more thing, stay positive. Always be grateful. I am grateful for the kids that we have. I am respectful to the kids that we have. You know, when there's something that needs to be done, always find a solution when presented with obstacles. Face stressful. I want us all to face the stressful situations with intention rather than reaction, and celebrate success, all the successes with a smile. Face the stressful situations with the intent that it will be resolved. Those are the things about building a foundation for success when you're doing social emotional learning that are tied into trauma. Adult SEL skills are directly tied to I just said, to our being trauma sensitive. Okay, primarily, the first box says trauma informed practices are primarily about primarily providing kids. That's our first day one. Walk in the school building every morning. Primarily, my first practice is providing for kids. Okay. My second, making sure the type of environment that they are in is good. You know why? Because I don't want to be in a bad environment. I don't want to come to school and have to worry about the environment that I'm in. So, of course, I'm going to foster the type of environment that I would want to see. But I know that I work with at least 20 or 30 different people. And I actually know that all of us do not somewhat agree on the type of environment that would be safe to foster for kids. So guess what? We do have to agree on the type of environment overall. But one of the things that I do know about trauma is that when your environment, your classroom, my office reflects the type of environment that I thrive in. And so when the kids come in my office, they can automatically feel comfortable because this is how I'm successful. What you see around here, what I've done to what I've done to my office reflects me and how I'm successful in the environment that I'm in. And I think that I encourage every teacher to have their classroom reflect their personality, their culture, what they believe in, as you have kids ask questions. We are in a world where kids have to ask questions in order to know what's going on. You don't want them to assume anything. And trust me when I tell you, even though you may think they're getting all their news from TikTok and Instagram, Facebook, Snapchat, and all these other weird sources that they have going on, they always listen to you. It's fascinating. I know it's fascinating. I actually believe it's fascinating that a kid is actually listening to me talk about world events and they want to know what I'm talking about. You know why? Because they always get the same thing when they leave our presence. Everybody in their neighborhood thinks the same. Everybody in their community thinks and acts and responds the exact same way. It is a breath of fresh air for them to hear a different perspective, and they're hanging on every word. So they do have good listening skills. Validate their feelings, and that's what we do when we have conversations. We don't allow people, to not validate their feelings. I validate my kids' feelings all the time because I don't live with them and I don't know what they're going through, but I do know that they have not only do have a wonderful perspective on life, they're going to give me a perspective that I never thought of, and I'm going to embrace that perspective. I'm going to, hone in on that, going to process it a little bit, and I'm going to have another conversation with them because that's how I want to foster my relationships. And trust me, we aren't always calm. We do respond more quickly to triggers and often in negative ways. So it is important to manage our stress and control our impulses. And I'm talking about adults. When it says when we aren't calm, but I highlighted we aren't calm because that's the truth. I'm not calm all the time. I'd be lying to you if I told you I was. I may sound calm now. Well, maybe a little excited because I am, because I'm talking to you guys, but we're not always calm. And there are certain triggers that we immediately respond to because they immediately get under our skin. That's why it's important for us to know what our triggers are. It's important to know how we manage those levels of stress when we come up against it, because we are going to come up against it. We are going to be faced with the very trauma that we refuse to check. One kid, and some of us may have already had that kid, and some of us haven't met that kid yet, but it's always one within your career, okay, that for some reason knows your trigger. I don't know how it happens. Maybe it's karma comes around. I don't know. Maybe it was some part of my personality that was like that when I was in school, and now it's come back to haunt me. I haven't figured that out yet. I'm not sure. But just remind ourselves that if we don't know who we are, we can't even begin to help them understand who they are. And so that last box says building, because we're always building. It doesn't mean anything. Building. Social blocks, emotional blocks, building. We're building kids up. We're building ourselves up. We're building our colleagues up. We're building our environment up, our culture up, everything that has to do with building. That's exactly what we're doing. Why? Because we're building to teach. We're building to model. We're building to shape. Everything we do, we're building to, because what we're doing when we build comes out in how we teach, comes out in how we talk, comes out in how we give back in our classrooms or in our hallways every single day. And so we support our SEL and trauma sensitive practice, limited vocabulary, trauma effective kids, social emotional skills. We're expressing emotions. Children exposed to trauma may internalize their feelings. Why? Because that's what they do. That's what kids do. They internalize their feelings and they don't want you to know anything. But the moment that they want you to know about them, the moment that they want to share with you, they're going to pour into you. And all I can say about that is be ready. Why? Because a trauma sensitive environment, the moment, and when I say environment, I don't necessarily mean a whole building. When I say trauma sensitive environment, I'm actually talking about you, me, us, the adults. We're the environment. And when a kid feels supported and safe, they're gonna talk to you. You're gonna have
Just
a
to give you
way.
10-minute warning.
Okay, thank you, Jenny. They're gonna have you, they have a way with you, and you have a way with them. Okay. And so when we start making those connections that I talked about earlier, when those kids see those connections forming and they see those things happening for themselves, that's exactly what happens. They start to bond with you and start to connect with you. And we have to be ready for that because you're the environment. Okay. Now, I got 10 minutes. And this is important because I want us to stop being so quick to move on to the next best thing before we know what the now best thing is. Some of you are working some amazing strategies and some amazing interventions with your kids right now. Don't be so quick to move on from those things. And don't be so quick to stop doing those things because they're working. And if you don't see them working, continue to keep working it a little bit longer before you give up. I promise you, you keep working it because most kids don't want you to know that it's working. There is an advantage to happiness because students translate that to empathy. You don't have to concentrate on showing empathy if it's how you really are. Because guess what? Nobody wants to be in a one-sided relationship. Okay? Nobody wants to journey alone. No one likes to feel alone, and nobody envisions living alone. And because of those three things, no kid wants to journey through this life or through this educational process or educational career by themselves. They are looking for something. So if you look at what I have up here on the front, you know, if you really look at those things, there's something that I want to point out. Anger, fear, disgust, sadness, shame, envy, and anxiety are all in the head and shoulders and in the chest area. All the flow of blood is concentrated on one or a couple of specific areas. They don't allow the person to move. That's why when when you think a kid is being disrespectful, it's because they can't move from one place to the next. Because everything about them, all the anger, the fear, and I know this to be true because I've done it myself. When you're asking somebody to get up, leave the classroom. If any of those in it, and they seem that they taking a long time, they start mouthing back at you, they start giving you all this, what I have on this slide. Everything about them, everything that's going on is in the top part of their body. It's in their head, it's in their chest, it's in their shoulders, in their arms. Their arms tense up, their shoulders hunch up, they start looking a certain way. I'm guilty of it too. I've always looked at that. Of course, I've looked at that as aggression. I said, hey, I need some help. I've called for help. Because that's what I see. That's what I was responding to. I was responding to the particular emotion that the kid was going through at that time. And I looked at it as a sign of aggression. And so I became aggressive in how I approach the situation, not realizing that all the blood in this kid's veins is in one place because now they can't think straight, they can't move, they're not doing anything. The only thing they're thinking about is what's making them angry. And you know how I was able to identify with that? Because I had to look at it as myself. When I'm angry, when I'm fearful, what am I doing when these things are happening with me? How am I responding and what am I doing when things are happening with me? When I'm angry, I don't move, I get quiet, I don't want to go anywhere. When there's anxiety there, when there's disgust or fear there, there's shame or sadness or envy or any of those things, being content, depression. Look at these things that we're going through, and we have to make sure that when we look at these things, that we relate these to ourselves. Because if I'm being called out or told to do something in the middle of a class and I got all these people here, I'm saying that because that's a traumatic situation. I'm creating the trauma for a kid that's already having a traumatic episode. And like I said before, doesn't have to be a huge thing. It can be a very small thing. As me telling the kids, stop chewing gum. They don't want to be told not to chew gum in your class. And guess what? Now we got a thing. And I can either be a part of the traumatic situation that can be caused by my tone and what I do, or I cannot be. Look at the other two things. There's only two things on this list that have complete blood flow from head to toe. Actually, one, and it's happiness. The other one is love, and I'll give that one. I'll give extra points to love because hey, it's love. But it actually your full body. You have full range of all your bodily function when you're happy or you're in love. And those are the two things that I wanted to point out on this chart, just simply because those are the things that we don't think about and how those things affect us overall and how those things affect our kids overall as we're going through this life cycle. Because trauma affects us in every single facet of our life. Every last one of those diagrams on that slide, trauma can affect you in some way, shape, form, or fashion. And when it hits, it can affect you angrily and you lash out. It can affect you in depression and you might want to harm yourself. It can affect you in sadness. It can affect you in disgust. You know, and we have to make sure that we have ourselves in check to know what that looks like for us. So it does, if it does, and I'm not, and it will, and when it does, we know how to handle it. So, because I have 4 minutes and 30 seconds left, I want to say build a social emotional learning every day. When you're building social emotional learning, when you're building ways to to be more aware of your social emotional state, you are definitely building. These are the building blocks for being able to handle trauma. So what? We're gonna rip the band-aid off and get the care for our healing of trauma. Healing for trauma. It's gradual. It's a process. It's unsettling. It can be long. It can be short. It can be short-lived. It can be long-lived. Um, it can be painful. Bottom line, healing from trauma is just downright emotional. Okay. And whenever there's something going on, or there's something happening, or there's a Hurricane Katrina anniversary memorial. Hey, let's think about what happened to us 20 years ago. It happens every year. And sometimes those feelings about what happened with me and my family come up every year. And how we deal with it every year gets farther and farther away, and to the point that now that it comes up and it's like, it happened. We are all here. We're safe. We're alive. We remember the ones that did, that we're not so fortunate. And guess what? We continue to keep pushing forward with the things that we dealt with, and any other family members helping them deal with things as well. That's what it is. Because it comes around, it ebbs and flows. It comes and goes throughout. And so it does disrupt your body. Get moving though. Instead of focusing on your thoughts or distractions on yourself while you exercise, really focus on your body and how you feel as you move. Trauma sometimes wants you to not move. It wants to stunt your growth. It wants to keep you down. It wants to have you in the bed with the pillows over your head and block out all the sunlight. That's not the way that you want to respond, to any traumatic event. When you're ready, get moving and make it a point to move. And then when you start moving, make it a point not to stop moving. Just keep going. The second, the second tip is don't isolate. Okay. There is always someone to help you, always someone there. Even it, don't isolate doesn't necessarily mean you have to find a therapist to talk to if you're not comfortable with that just yet. You have to find somebody in your corner. Don't isolate means to start believing that you can live a normal life, and start helping our kids believe they can live a normal life. Start encouraging them and inspiring them that they can do this, that it's not the end of the world. They look at our lives and they swear, man, that they think that we are just so far beyond, that our lives are so untouchable from what they can have in life because they're only looking at where they are today. If a lot of us, if we looked at where we were back then just for the day, we might not be here. So start encouraging them. There's just a couple of things. There's a couple of tips that I want to go through to start encouraging them and letting them know, who they are, how they can overcome, what they can do to be resilient, because these are the things that build resiliency. Self-regulate, allow yourself to feel what you feel when you feel it. Acknowledge your feelings about the trauma as you arise and accept them. Feel what you feel when you feel it. A lot of kids try to suppress that, but encourage them to feel what they feel and then talk about it, because that is where victory is. And then you want to take care of your health. We're always about avoiding alcohol and drugs. Weed does not help. I know I got some high school parents and teachers out there, some middle school teachers out there. Trust me, we are in a battle where we're constantly telling kids weed does not help. Continue to keep preaching that and give them other reasons to find ways to relax and to find other ways that are a lot healthier, okay, than smoking weed. It's not gonna get it done. And that was my last thing. Those are my credentials. If a student doesn't feel respected, he or she is not going to show love. If a teacher doesn't feel love, he or she is not going to show respect. Okay.
Thank you so much for that incredibly powerful presentation. That was amazing. I loved the passion in your voice, and I know that others did too. We had a couple questions that came in. I do also encourage that you please send your questions, respond to the email later, or also Melvin here was really generous to provide his own contact information. So before we go, I would like to just ask a couple of the questions that came in, because I think for the next maybe 5 minutes we can do some Q&A. So we had one question that came in and said, is it healthy to allow children to form an attachment to us? How do we keep that attachment from becoming toxic? For example, a 3rd grade student sometimes wants to skip class to be with me all day. How do I use his trust in me to redirect him back to class?
Okay, that's a great question. I love that question, actually, because this gives me an opportunity to introduce other colleagues into our circle. If this kid thinks that it's just between me and him, then this gives me the opportunity to bring in another colleague of mine to start building, different areas of support with different areas of teachers, so that I'm not the only one that kid comes to. Does that make sense?
Yeah, that's great.
I wish I could. Yeah, it's weird answering questions you don't get to. Yeah, but that's one of the things that I do. And when I find out by the clinginess, because that's what that sounds like, when I'm asking questions about what's going on and how those things are happening, I'm building a file in my mind about how I'm going to talk to maybe the counselor or other colleagues of mine, how I'm going to let them know what's going on, how we can attack this, because I'm not going to leave the kid by himself, because that could trigger abandonment. So I'm going to make sure the kid knows that I'm with them every step of the way. And as I build those different types of resources with other colleagues, I start to build a better support system for them.
Yeah, that's great. And then I just want to ask one more question. If you have a favorite technique to really help start convincing students that they are safe in a school environment.
Okay, actually, I do. One of the things that I love to do, I ask the kids. Well, we're in my room or whatever, and I'm doing an intervention, and I say, "Hey, what does safe look like to you?" And I get all these different responses, right? And so I take all those responses and I come back and I say, guys, I put all the responses on the board and I say, okay, everybody in here said that this is what safe looks like to them. All right. So you mean to tell me that when we're in this building, this is what you need to be safe? And so then I get a whole nother set of responses. And so we really start narrowing down 3 things, because I want to know if these 3 things are happening on a day-to-day basis, that you can come here and feel safe. Then number 1, I want to see your grades go up. Number 2, I want to see your attendance on point. And number 3, I want to see you a lot happy. I want to see some smiles. I want to see, some camaraderie. I want to see something that says that you're glad to be here. Because if we're creating the environment of safety, then these are the 3 things that should be happening in that environment. And I allow them to do that. Okay. And so because I allow them to do that, when they start seeing things, they'll see things, because I can use my classroom as an example. They'll start seeing things in the room that reflect what they talked about. And so now their voice is being heard. And that's really all a kid want. They want to know that they're being heard. They want to know that they've been understood, and they want to know that you're taking them seriously. And when I start doing that and they start seeing those types of things, that's how I start breaking down the safety.
That's great. We did just have one more question, if you don't mind us sneaking in one more.
Yeah, no problem.
Okay. So we had Karen write in along the same lines. How do you redirect a student to peers when they only want adult time and are very clingy? Also, one who tends to linger behind to get adult attention additionally.
I would actually, now that's one I would actually try to find out what's going on. That sounds like something I need to know what's going on. I need a little bit more background information as far as the home is concerned, because a lot of times when kids are clinging to adults, it's because they're adults themselves. Two things are happening: either they're being bullied, okay, they're looking for a safe adult to talk to about something that may be serious, like severely serious, that's going on, not at school, but maybe at home, or they think that they're adults themselves. And so I would definitely get a counselor involved to start breaking down. We would actually sit down, start breaking down what we see and how we can effectively manage that particular situation. Basically, coming up with a plan of attack, because eventually when kids are clingy, they want to talk. We just have to create the environment for them to talk in, and we have to create a safe space for them to where they know, because kids are very keen on about snitching or being seen as a snitch. So we have to make sure that the environment that we put them in and the space we put them in is a place where they can talk, because I'm telling you, the more they hang around and the more they linger around, they're trying to build up the courage to give you some information that they haven't shared with anyone.
Well, thank you again for this incredibly powerful webinar. Reach out to us, all of our viewers. Thank you for spending this afternoon, evening with us. We hope to see you again. Let us know if you have additional questions. As I mentioned, that certificate will be coming in an email in about an hour, as will a survey. So please do fill that out so we can continue to plan more webinars like this that hopefully will be useful. So, and especially thank you so much, Melvin, for sharing your expertise, your passion, and your time today.
You're welcome. Thank you.
Have a great night, all.